Dr. Tiwari, you are an expert in the management of enuresis, and I would like to share your experience to help parents of children suffering with this issue. Can I know about your experience in this field?
I have over 30 years experience and interest in pediatric kidney and bladder disorders. I worked in India in this field and further pursued it in the United Kingdom. I have initiated special clinics for this in various NHS hospitals, and now I'm extending it to private clinics and hospitals as well.
What is nocturnal enuresis?
Nocturnal enuresis is a medical term, and if we talk in layman's language, it is bedwetting.
When do you call it nocturnal enuresis?
It's very normal to have bedwetting till about 5 years of age. However, if a child continues to have wetting after 5, then we call it nocturnal enuresis.
How is it diagnosed?
Diagnosis is mainly based on history and physical examination, which should be thorough. However, at certain times we do need investigations such as ultrasound of kidney and bladder, mainly to look at the structure of bladder and the emptying capacity. And sometimes we do need bladder studies called as urodynamics. And very rarely we need additional investigations, maybe MRI of spine or some other modalities of investigations.
How is it treated?
Treatment is various modalities starting from behavior modification. This includes STAR chart and a positive reinforcement of the child to get involved in being dry. And then comes the stage of medications, which can be desmopressin, which is a hormone, and or anticholinergics. And occasionally we may need other medications as well.
What should parents do to prevent or improve it?
A good bladder discipline always helps, and that can be done with a good liquid intake. So at least 6 to 8 glasses of water or any other similar liquid I recommend, as well as emptying the bladder every 2 to 4 hours. Apart from that, constipation is a major contributing factor which should be taken care of, as a full rectum can irritate bladder, and at the same time a good hygiene should be maintained.
What not to do?
Certainly, I do not recommend to lift the child once he has gone to sleep. Quite often tried by parents, and this actually does not help but disrupt the child's sleep. There should be no negative reinforcements such as criticism or comments or any punishment, and I recommend to have a very positive environment around the child.
When would you recommend parents to see a doctor?
Certainly, if the child is not dry by 5 years of age, I would recommend to see a school health nurse or your doctor. And the evidence shows that if children have gone beyond 7 years, then it can be slightly concerning in the long term.
Thank you very much for your time and information, Dr. Tiwari. I'm sure parents will find it very helpful.
Thank you.